we're still talking about coronavirus. It looks like we'll be talking about this for a rather long time. Well, the outbreak in Ghana, like I said, now puts us in a situation where the country must be on alert at every level, examining each person to be sure that we are able to identify anyone that has the virus so we can halt the spread. So will this be possible? How prepared are we? Do we have enough testing kits, for example, for these cases? I have two scientists in the studio from the West African Postgraduate College of Medical Laboratory Science to have that conversation. Gentlemen, you're welcome to the show.
Thank you.
Well, before I engage them quickly, I'd like to let you know that the government press conferences, they're set to bring us the press conference this afternoon. Kojo Meno, NS Kojo Meno is standing by. We can bring you live visuals from that location right now. Okay, we'll bring that to you as and when we have it. But right now, I'm going to talk about how prepared we are as a country as far as testing is concerned. Now, in the United States of America, there are complaints about the number of tests they can do, which is way below the number of tests run by China when it started there, way below what South Korea did when it started there. What is our own story and how can we beef it up? So you have this press release here, which I'm looking at the moment. And in this press release, you're talking about how you would like to support or partner government in making accessible laboratory testing.
Yes.
Let's begin from how you intend to do this, because we've heard what happened in the United States where they wanted to, manufacture their own test kits. They didn't do that, and so there are complaints about the very little number of tests they can do, for example, based on what they have. So what's your own story?
Well, for us, we find government is doing very well with the public education bit. We believe that adding testing to the public education would push the frontiers of trying to curb this virus.
When you say testing, should we just test, or
we're looking at testing communities? Now, Ghana has public health reference laboratories. Reference labs scattered around the country. We have one in Tamale, we have in Kumasi, we have in Efiankwanta, we have one in Accra. And for what Noguchi and KCCR are doing, molecular testing, these labs can be equipped to do same.
Okay.
Now, our problem is that, for instance, we just had Burkina Faso, recording a death. So people are crossing that border. What is the story up north? What we have here is it looks more like the Accra picture, more or less, or the southern area of Ghana, more or less. What we are pushing forward is that, can we have clinical testing at the peripheries, such that people will have the screening. So you screen these people, those that come out as positives, we refer to the reference labs or the Noguchi and KCCR, so that we'll have more people picked up.
At the moment, they're doing the testing, the screening, if I get you right, because we've just seen a story from our correspondent in the OT region where he went to the border, one of the borders, and he saw that people are being screened. Is that not enough?
Screened with the hand gun on their face, that is checking their temperature.
Okay.
Now we are referring to scientific detection of whether someone has evidence of the virus in his or her blood.
Okay, let me bring Prof in here. Prof, when you say scientific detection of whether a person has this in their blood, what exactly? Break it down for those of us who don't understand science very well to understand.
Okay, so thank you for having me. And then I want to, first of all, create the picture of the kind of people we are dealing with. One, we have some group of people who have already been diagnosed in the country. And the category of people that they have come into contact with, who are today roaming around the street, that we don't know what is happening to them.
Yeah.
We have some other category of people who have the infections, but they are asymptomatic. They are not showing the signs and symptoms of their condition. So they're just roaming around as being normal. There are another category of people, because when you look at these particular conditions, it has similarity with other scenarios like influenza, like pneumonia, and other SARS conditions. So you will not be able to tell at a go that what you are dealing with, it is COVID-19 or different condition. Now, he has talked about the issues of the Burkina Faso, what is happening. We are aware, if you read science, research has shown that people at the entrance of the flight take analgesic just to reduce the temperature.
Yeah.
So if you are relying on the gunshot at the airport or at the port to detect the temperature, you will miss a lot of a lot of this category. So we are saying that we needed a screening test that even when you take an analgesic that lower the temperature, it can still pick you up, and then we can diagnose these people and then refer them to the molecular testing for confirmation.
Okay, so they're talking about molecular testing for confirmation, which is that they're saying that if essentially the temperature guns that they're using to check your temperature may not necessarily pick up symptoms or show that people have it, and they're asking for scientific detection, which they're willing to help with. I'll come back and ask them whether or not they've engaged government and how that engagement is going. But quickly, government announced 4:30 for its press conference. Right now, it's about 7 minutes above that time. Kojo Menu, my colleague, is standing by for us. Let's get to him and find out what we can know. Kojo, what can we know at this point? Hello, Ernest.
You know.
Yes, Kojo, do tell us. It's been about 8 minutes.
Yeah, Gifty. So we do know that this is an update on COVID-19. The information minister is here. It's not clear exactly what will be addressed, but in the last few minutes, I saw him in the company of some senior immigration officers. We do know that the Ghana Airports Company have, in the last few hours, actually since yesterday, denied entry for some people who are non-Ghanaians and from countries where the COVID-19 has been recorded, people with cases of over 200. And so far, the immigration services here, we're hoping to have an update from them. They will be telling us exactly what they've been doing over the period to help prevent the spread of COVID-19. I've also seen the Dr. Ojosan, who consults for the local government ministry. And you know that as part of the president's directive, the MMDAs are supposed to activate emergency response within their districts. And so perhaps we'll hear from him as well on what government is doing on that front. So that is it for now. In a few minutes, the press conference will be underway and the information minister will be addressing some of these issues and a lot of issues that have happened in parliament as well. We were expecting that the legislation to back the president's directive should have been passed yesterday. It is not done as we speak. Hopefully he's going to give us an update on that. But one thing interesting that is happening here, something interesting happening here, is that the ministry is observing the protocols as far as social distancing is concerned. So even here at the hall, the sitting arrangement is different. Just a while ago, the deputy PRO for the ministry announced that the sitting arrangement is going to change just to observe the social distancing that has been announced and ordered by the president. And so we are sitting one seat apart from each other. And so that is what is happening right now. In a few minutes, the press conference should be underway and we're going to have details of what government wants us to know. And if there's any update as far as the cases recorded, we would know in a few minutes, Gifty.
Right, Ernest Kojo Menu. Ernest, thank you. Ernest Kojo Menu is my colleague here. He is at the Ministry of Information, Ministry for Information. We understand that there is a press conference coming on. As you can see, it's all set. We're hoping to get more information. He has what to expect at this particular press conference. What is happening to the emergency legislation? What is happening to the cases we've recorded so far? 7 so far. Any updates on it? All of that we'll get to know as and when. Let me wrap up this conversation with the gentleman I have here in the studio, Professor Nafiu Amidu, president of the West African Postgraduate College of Medical Lab Science, and Dr. Ben Mensah is executive council member of the same association as the Ghana chapter. And they're talking about partnering government to ensure that there is scientific detection of whether or not someone has traces of something that could lead us to coronavirus. Let's wrap this up. I want to find out from you, have you engaged? I mean, this is essential support that the country needs at this point. Have you engaged government agencies? What are they saying?
Yes, we have engaged government. In fact, we have been speaking with the ministry. We have had conversations with the deputy minister today. We're very grateful that he showed a lot of promise regarding that. As a matter of fact, we are very poised. Should we be given the nod? This is one agenda we want to push very forcefully.
All right.
That as much as possible, let us do some peripheral testing, especially at our borders, at our clinics. Our clinics, our hospitals keep getting exposed. A lot of people walk in and they are healthy, but they are doing the spreading. So as much as possible, if we are to believe that it's only 7, which we have evidence from all over the country. So this one agenda we want to push for forcefully.
Prof. Nafiu, let me take you as a final word on this. What if government doesn't listen? What can we do?
Well, in our little way, we've planned to procure with our own resources some testing kits and see how we can, in our own little way, to resource the various regional reference laboratory to be able to do this testing. And then we do have the capacity. We have members who are able to develop and manufacture this test kit within the country. So we are going to use that.
Very interesting development, I believe, and I'm sure that perhaps government will be able to get in touch with you to find out how we take this forward. Unfortunately, we've run out of time, but this is very important information. Professor Nafiu Amidu is president of West African Postgraduate College of Medical Lab Science. He's here with Dr. Ben Mensah, who is Executive Council member, the Ghana chapter. Unfortunately, this is where we have to call it a wrap. But there's more news at myjoyonline.com. If you do log on, and you find a lot of stories about coronavirus. You can also scroll all the way down. Our YouTube link is there, and it has the programs from here on the Joy News channel. Take your time and look through it. Unfortunately, once again today, we're unable to bring you the story on our Arrive Alive campaign, but it's all about Nelson Mandela's granddaughter, who has been here in Ghana, throwing her weight, backing Joy News' Arrive Alive campaign, sharing her own accident experience. Wherever you are, Arrive Alive. Stay safe also from coronavirus by washing your hands thoroughly and observing social distancing. My name is Gifty Ando Apia.